I have reviewed the physician's orders, and today I'm going to be providing trach care for my patient. I provided privacy. I performed hand hygiene. I introduced myself to my patient. I identified my patient using 2 identifiers. I explained the procedure to the patient and tell them that today we're going to be cleaning their trach. And so then I gather my supplies, and I'm going to go ahead and get started. I have normal saline, and I'm gonna lip the bottle and then pour my normal saline into here. I'm gonna throw this away. I'm gonna throw that away. I'm gonna make sure that my wall suction, the suction isn't any more than 125 on the wall. I'm gonna go ahead and connect this to the suction, and this would fit on there together. And then I'm gonna go ahead and test this in my saline. Now I'm ready to suction. I'm gonna insert this, not until I meet resistance, but until the patient coughs. And then I'm gonna withdraw this, and I'm gonna suction using my finger right here to close and open this while I withdraw. No, I didn't hyperoxygenate my patient. Prior to suctioning my patient, I would apply oxygen, hyperoxygenate for 30 seconds, no more than 3 minutes. Then I would suction the patient, and then when I finished suctioning the patient, I would hyperoxygenate the patient again for 30 seconds to 3 minutes. And if after that my patient needed to be suctioned again, I would continue with the suction, and I would hyperoxygenate every time before and after the suction. So now I'm gonna throw this away into my biohazard bag. And my patient has been suctioned, so now I can change their dressing on their trach. I'm gonna throw all this away in here. So for the trach care, I have normal saline and hydrogen peroxide. I'm gonna set up my sterile field first. And I'm gonna lip these bottles into the trash, and I'm gonna put hydrogen peroxide and normal saline into the big compartment, and then I'm gonna put the normal saline in the 2 small compartments. And now I'm going to put on my sterile gloves, keeping my hands above waist level to maintain sterility. Now I'm going to remove the inner cannula. And only touch the outside. I'm not going to touch the inner portion of the cannula. And this middle part's really hard to remove. I'm going to drop that down in there. And now I'm going to clean, I'm going to clean the patient. So clean hand, and this is going to be my dirty hand. So I'm going to put that into one of my containers. So this is my dirty hand, clean the top portion up underneath. Dispose of that. Clean hand. Put this into the same compartment. Dirty hand. Bottom portion. Dispose of that. Now I'm gonna dry. Okay, and now I'm gonna use my clean hand to take this out. And I'm going to use this okay, I'm going to put that back in there for a second. Just pretend I didn't even take that out of there. Okay, so there's nothing I can do about that. Okay, so I'm going to clean this. And then I'm gonna dispose of this. And now I'm gonna rinse it. Now I'm gonna take it out and I'm gonna dry it. Now I'm gonna put this back in, only touching the outer portion. I'm gonna lock that back in there. Okay, and the patient would have a dressing there, and I would remove that before I reapply the dressing, and I would look at the dressing, and I would look at if there was any blood or anything like that on it, and I would document that. So I'm gonna get my new dressing to put on there. And I'm gonna slide this up underneath here like this. It's not letting me go. Being careful not to dislodge this whenever take it out. Okay. And And now I'm gonna tie the ties on this to hold it on there. So I would have ties already tied, and I would leave those ties on there while I'm tying the new ties. So I would tie this on one side, and then I would have somebody in here to help me to make sure it doesn't come out. Then we would sit the patient up just a little bit, and we'd wrap it around the back, and then I would tie it on the other side, and I would place 2 fingers up underneath to make sure that it's not too tight on the patient's neck, and then I would remove the other ties, and I would throw all my stuff away and document. I'd make sure the patient's in a comfortable position, and the bed's in the lowest position, and the side rails are up, and that they were okay. And that's it.